One of the goals that our executive director at UNAIDS has set is to eliminate TB, HIV co-infection. And the group that we look to help that to happen are health workers. However, they're the most vulnerable, and they need themselves access to services and ongoing quality treatment. They are our bulwark. They are the front line in the response for TB, HIV co-infection, both diagnosis and treatment. And they are critical. So these guidelines provide them with that special protection that they need. One more thing to mention about healthcare workers is they are really, because they are the first interaction that many people have when they are tested and found to be positive, either for TB or for HIV, that interaction is a critical one. And it's there where the issues of stigma and discrimination have to be fought and won. So protecting healthcare workers also acknowledges their critical role in trying to diminish the stigma and discrimination that accompanies both of these diseases, both of these infections. So this is an exciting day to see very clear, very operational guidelines coming out.
It is a great pleasure for me to participate on behalf of the International Organization of Employers in this joint effort of the ILO, WHO, and UNAIDS. For those of you who don't know the IUE is the only recognized voice at the global level of the organized business community on social and labor issues. We have 148 national employer organizations representing all types of companies and sectors. This year is our 90th anniversary as the institution that has been coordinating employers' issues in the ILO since its creation. We have been committed for more than a decade in partnership with unions and other international actors to address the effect of HIV and TB epidemics on the world of work. In 2003, a joint global agreement to operate worldwide, together with unions, was signed with the ICFTU. Occupational safety and health is one of the key areas of the IUE. For the IUE, the loss of skills and experience from those overcome by the epidemics threatens productivity, the survival of private enterprises, quality public services, and undermines the livelihoods of workers and their dependents. At this year's International Labour Conference, we work intensively to develop the Recommendation 200 concerning HIV/AIDS and the world of work, which builds on ILO Code of Practice. We have supported the many initiatives of developing policy frameworks, but most importantly, the IUE wants to turn principles into practice. To do so, the IUE has developed two important guidelines for its members. First, the IUE UNAIDS Employee Handbook on HIV/AIDS, and most recently, Facing HIV/AIDS Challenges in Africa. Individual sectors are affected differently by the spread of HIV/AIDS and TB. It is critical to provide assistance for the healthcare sector, because this is the sector that is in the front line for response to the epidemics, but also in the front line for attack from them. The growing demands of all societies for healthcare provision places a particular strain on that sector. Decades of progress in development, training, skills, and education can be eroded by the loss of skilled workers and managers to these epidemics. Such threats today undermine the capacity of nations to deliver healthcare services tomorrow. The guidelines we are launching today will go a long way to support healthcare workers and managers in their efforts to prevent the spread of the epidemics, to retain staff in the healthcare sector, to support and rehabilitate those affected, and to influence and motivate communities. We are particularly supportive of the approach of these policy guidelines because they coordinate and amplify the efforts of several UN agencies and provide timely information to build on the international policy instruments. Because the guidelines take a risk-based approach to prevention of work-related infections, in this case HIV, AIDS, and TB, but information can be used generically. Because healthcare organizations are not different from other enterprises. They are bombarded with initiatives, and it is important that the messages they hear on prevention of HIV and TB at the workplace are aligned with national programs. Because they embrace a whole society approach to the impacts of the epidemics on people, enterprises, and communities. Many employers, particularly in developing countries, provide their own healthcare facilities for their workforce and families, and they have innovative approaches to the management of HIV, AIDS, and TB. The employer experts involved in the development of these guidelines were most pleased to share their approach so that more organizations can learn from each other and strengthen their capacity to cope and continue to provide care for those that provide care to others. Thank you very much, ladies and gentlemen, for your work and for giving me the opportunity to be with you today. Thank you.
I work as a HIV AIDS coordinator for the International Trade Union Confederation, and I would like to say that workers are extremely happy about the strengthening of the legal framework and the human rights-based approach to HIV/AIDS that took place this year in the UNAIDS family, especially in the ILO with the adoption of the new recommendation on HIV/AIDS and the world of work, and with regards to the adoption of these guidelines. And we are very happy about these two instruments because both of them help to highlight the role of workplace in providing with prevention, treatment, care and support, and both of them help to build a human rights-based approach to this pandemic, which is not only a medical issue, it's a social issue. And it highlights, the two instruments highlight prevention, rights of the workers in terms of no mandatory testing, in terms of confidentiality, right to work, retention and access to work, and other very important empowering regulations. We call for a recognition and awareness that healthcare workers are exposed to occupational risk of infection with HIV, TB and other diseases, especially when there is no appropriate occupational safety and health. So we want to draw the attention to the fact that the appropriate occupational safety and health regulations and infrastructure can prevent death and tragedies in people's life. And we want to call for the recognition of the fact that we still have a lot of critical problems in the healthcare sector. And we want to ask the question, do we really provide healthcare workers with the empowering environment? The evidence shows that there is still a lot of stigma, also self-stigmatization among the healthcare workers, that there are gaps in prevention with regards to such a simple thing like a post-exposure prophylaxis. The most dramatic situation is where there is access to a prophylaxis, but there is no uptake because of being afraid of being stigmatized, being discriminated against. So this is really appalling, and it's on all of us to try to address this issue. The same as the fact that healthcare workers worldwide experience so much of discrimination in recruitment and employment, also not only from employers, also from their co-workers, sometimes from the families, as all the people living with HIV/AIDS. So we want to call for the recognition that healthcare workers is a critical resource in addressing and with solving the problem of HIV/AIDS in the world. And we more or less are aware what a disastrous situation we have globally, where Southern Africa has around 60-65% of global people living with HIV/AIDS, while having 2% of global health workforce and around 1% of global expenditure on health. So I think that shows the problem. And also it's important to be aware that healthcare workers are our carers. We go to them with our diseases. We go to them exposing them with with our own state of health, and we want them to help us. And they have a responsibility to help us, but with the responsibility come the rights. And for the healthcare workers, that's the right to have a priority access to prevention, treatment, care, and support with regards to HIV and TB, also with regards to other diseases. So we want to call for the national implementation of these guidelines, and as trade unions we want to support the process at the national level. Also at the regional and international level, we call for the follow-up on the implementation of these recommendations, and also for the more intersectoral dialogue at the national level, for instance, with regards to involvement of ministries of labor and recognition of the fact that healthcare is also a labor issue, and at the international level for the continuation of a dialogue and common work between different UN agencies and ILO, providing with expertise on the workplace dimension of the problem we face. And we want to support our argument about the role of the workplace with providing with prevention, treatment, care, and support. And we want to call for more social dialogue, because actually both in terms of the recommendation that was adopted this year and these guidelines, workers and employers were very much in alliance supporting these documents. And this alliance was very much widespread. Governments, workers, and employers were working hand in hand on what we have on the table now. Thank you very much.
I would like to start just to give you a snapshot of what will be, what is it in the world. HIV is most heavily hitting Africa, where 70% of HIV-affected person lives, but only 3% of health care workers is in African continent. I was talking with one principal of nursing school of one country. She just finished a cohort study of their alumni. Within 5 years, 1/4 left country, 1/4 left occupation, 1/4 become sick, 1/4 still working. I think it's barely tragedy. HIV, tuberculosis, malaria, and neglected tropical disease, which I'm responsible for, that is bottleneck of development of many countries. We need to solve this bottleneck. Then this issue of HIV tuberculosis co-infection comes. One country in Africa, it's alarming. 80% of TB patient is also infected with HIV. And we are very much worried that HIV-TB co-infection is a home of drug resistance TB, which is very difficult to cure. It's very expensive to cure. So that is our alarms, which we need to go to control it. HIV finally become plateau and start to decline. Tuberculosis, since 2004, we are on decline, but the pace is much slower than we wish to see. We need to do much. But charity starts from home. We need healthy workforce, healthy healthcare workers who can look after own people. That is about this guideline. WHO has many clinical guidelines, prevention guidelines. For example, this year we started recommend member states to initiate HIV treatment much earlier than previously. That will bring a healthier and longer life. So that is we are advocating. But we need strong policy framework. I understand this guideline is just about this in workplace. This guideline is covering national policies that needs to ensure priority access to healthcare workers to HIV, TB prevention, treatment care, and support services. This guideline also covers workplace actions to develop occupational health services. And this guideline includes recommendations to provide adequate financial resources for prevention, treatment, and care and support. This is very important documents for countries to move in collaboration with many stakeholders, trade unions, employers, employees, governments. All of us need to join forces to bring our people to one step closer to our targets of universal access of care, treatment, and prevention. Lastly, Paul, if I may, I'd like to do a little bit contribution to Mr. Diop, who is hosting this venue.
Welcome to ILO. And let me first say that today is an important occasion for all of us, as indicated by the previous speakers. And let me thank my friend Antonio Peñalosa, the Secretary General of IE, Mrs. Gorsa, focal point on HIV/AIDS of the ITUC, of course, Dr. Nakatani, Assistant Director General in WHO, and all those who accepted to join us today. We have heard the testimony of the President of the American Nurses Association on this issue. And we note that there are 60 million health workers worldwide, vital workers who take care of the health of all of us. On average, each health worker may be exposed 9 times every year to nickel stick injuries on the job, putting them at the risk of HIV. Compared with other workers, health workers are 5 times more exposed to risks of TB, particularly multi-drug resistant TB, and even worse, the less treatable extraordinary drug resistant TB. And yet, only 12% of the world's health workers have access to occupational safety and health services. And we may confess that this is a dramatic situation. And as stated in the ILO recommendation 200 concerning HIV and AIDS in the world of work, which was adopted last June this year, health workers have the right to a decent work environment. They should have access to preventive equipment, gloves, masks, other safety devices, and good ventilation at the work site. Health workers should not have to work under constant fear of getting an infection while taking care of people's health. They also need physical and psychological support, and their job security should not be threatened because of the one-job infections. Mes chers amis, il y a actuellement une pénurie critique de travailleurs de la santé à travers le monde. Ils sont donc, disons-le clairement, un trésor que nous devons protéger. Le BIT, l'OMS et l'UNICIDA ont pris un engagement conjoint de travailler avec les ministères du Travail et de la Santé, les organisations d'employeurs et les organisations de travailleurs, pour mettre en œuvre les 14 points pour l'action figurant dans les directives. Et ce n'est que lorsque les travailleurs de la santé disposeront d'un environnement de travail sécuritaire avec accès aux services de prévention, de traitement, de soins et d'assistance relatifs au VIH et à la tuberculose qu'ils seront en mesure d'assurer correctement notre santé collective. Le thème cette année de la Journée mondiale du sida est intitulé « Accès universel à la santé et droits de l'homme ». Ces directives conjointes de l'OMS, du BIT et de l'ONU-SIDA fournissent donc la solution pour protéger les travailleurs de la santé, chargés de protéger la santé de chacun d'entre nous. Ensemble et avec les travailleurs de la santé, nous pouvons faire du secteur un lien où on peut travailler sans crainte et sauver des vies. La participation de l'OIE, par mon ami encore une fois, Antonio Peñalosa, et de la CSI, nous autorise à croire au succès de notre action parce que ce sont là des acteurs déterminants. C'est une responsabilité partagée que nous faisons le serment de prendre à travers notre commune volonté d'agir pour le renforcement des systèmes de santé et l'accès universel à la protection des travailleurs de la santé à travers ce lancement officiel. Et nous vous remercions encore une fois de votre présence à tous. Merci beaucoup.